Taba ra ọjà, taba ta à ń gain níbẹ̀. So gain taba dẹ̀ rí, ó fi ń tọ́jú àwọn ọmọ mi. Láti ọ̀dọ̀ Àìjíà, ìgbà tí mo bí bébì mi, nǹkan kan yọ sórí ẹ̀ ń bí báyìí. So wọ́n ní láti refer wá sí lóòtù pé àwọn ò ní engine tó lè ṣe iṣẹ́ yẹn. Wọ́n refer wá sí lóòtù. Wọ́n á dẹ̀ tún fẹ́ kán tún bá wa tẹ́ wa lọ́rùn tó wọ́n ń tọ́jú wa dáadáa. Ọkàn wa dẹ̀ ti balẹ̀ pé àdàmú wọn gbàtà tí a ti wà láìjíà. Abdulmalik, bye bye.
My name is Dr. Folajimi Apara. I'm the medical director of these facilities. And my responsibility here is to coordinate the medical administration of this place. We have been in partnership with HPSP for about 5 years now. We have a quality control department. The quality has improved in terms of administration, the doctors, the equipment, and also we find that we are able to employ more qualified staff. Well, you are okay, my dear. So
our target audience for the health insurance scheme are low-income earners. Part of the main goal of the health insurance is to provide or to allow for equitable access to affordable and quality healthcare services. We do reach our target audience, the Lagos market women, having our local offices in these markets. The benefit package is actually developed to address the common illnesses. With regards our own program, it is more or less the ticket to access quality healthcare service.
Because when the patient come in, you want to make sure that they are satisfied with the type of services they get here. Before we joined HPSP, we used to have about 7 patients per week delivery. We deliver between 20 and 28 babies per week now, which is an improvement. Since the inception of our association with the HPSP, the number of patients we have has increased. This has translated to an increased income for the hospital. We have been able to purchase an ultrasound machine, which before we have to send patients out. Now we do it in-house, and it's faster and easier for me clinic to process this. So when they are sick, we expect them to come in. They are seen at the front desk, they present themselves, show their card, and then they are registered. We see them and put the diagnosis, the drugs that they are supposed to be given, and the appointment. They're all on the IT system. By the time you put in your claims and they pay you, you have the money to use for so many things that you need to do.
That's my uncle Barney by chair. Àwọn èèyàn ló ti ń sọ tipẹ́tipẹ́. Ìgbà tèmi máa bẹ̀rẹ̀ ọ̀rẹ́ mi kan ló sọ pé òun ti bímọ síbẹ̀ pé kémi náà lọ try bẹ̀. Dàda tún fẹ́ láti ọ̀dọ̀ Àìjíà. Ebi bí ọmọ tí oṣù yẹn ò pé. Wọ́n bá ti bá wa àwọn ìgò wọ́n bá wa kọ́ adẹ̀ tún fẹ́ wọ́n tó bá wa ṣe hospital yẹn tún pọ̀ kó pọ̀ sí. Ọmọ tí mo kọ́kọ́ bí general hospital ni mo bí sí. Owó tí mo dẹ̀ san 20,000 ni. Bọ̀tẹ́lẹ̀ ìgbà tí a ti darapọ̀ pẹ̀lú máwọn Àìjíà. Owó register 1,200 lẹ́yìn àwọn ọ̀dẹ̀ gbó kankan lọ́wọ́. Bá ṣe ń register Nàìjíríà tó bá fẹ́ bẹ̀rẹ̀ ọ́fíìsì wọn wà ní inú ọjà wa ń bí báyìí. So bá ti débẹ̀ wọ́n á béèrè orúkọ pẹ̀lú fọ́tò wọ́n á dẹ̀ fill form fún yàn. Owó tó yẹ ká máa lọ sí hospital mi ìgbà tí Àìjíà dẹ̀ ti dé tó ti ràn wá lọ́wọ́ àti a fi ń ṣe nǹkan míì nínú family a fi ń san school fees a dẹ̀ fi kó ọjà náà. Bicycle.
The HCSC scheme is really important for the community because it allows them to have access to medical care at an affordable price and also quality medical care. We applied for a loan from the Medical Credit Fund because we need to improve on so many areas in the hospitals. Like we need to get some equipment which is very, very important and which we have not been able to acquire, like incubator and anesthetics machine. If the Medical Credit Fund should grant us the loan we are seeking, in 5 years' time, I see ourselves having established more clinics. We hope to establish at least 3 more clinics per year. So in 5 years, we should be having about 15 clinics closer to the market women. We are presently at level 3 safe care standard, and in that 5 years, I see ourselves as having attained level 5 standard. We are always looking into ways of trying to improve our standards.
In most developing countries, the public sector is unable to meet the growing demand for healthcare of its people. Therefore, 50% of the people turn to the private sector instead, paying for healthcare out of pocket, since insurance is practically non-existent. Too often, this leads to catastrophic health expenses. Our aim is to increase access to affordable quality healthcare for low-income groups by strengthening the private healthcare sector. This is how we work. Let's look at 3 key stakeholders in a healthcare system: the doctor or private clinic, the patient, and the insurance company. The system needs the following elements to ensure further development: access to affordable capital, enabling the doctor and insurance company to improve quality care and serve more patients; prepaid subsidized insurance, enabling patients to access affordable healthcare without the worry of how to pay for it; and quality standards, enabling the clinic to offer the quality care that patients demand. Our organizations enable this process in order to reduce risk and increase trust for consumers, doctors, and the private health sector. This leads to an upward spiral of higher quality healthcare, more people being willing to prepay for health insurance, and steady revenues for providers. The impact of this process is constantly monitored. This sound situation attracts additional capital from the private sector, such as from banks and international investors, but also from the public sector, on the national and international level. With increased revenues leveraged by donor money, we can further develop local capacity and infrastructure for healthcare. Only then can healthcare start functioning for the poor. This public-private approach is currently being implemented in several African countries. It has set an example and has been a pathbreaker in development cooperation.